Hello friends, today in this video I am going to discuss about the MCQs on immunology, and this is the 11th part of the series of more than 1800 MCQs on immunology. Okay, and this video will be beneficial for many life science exams like CSIR NET or ICMR NET, GATE Life Science, MSc entrance exams, or medical laboratory technologist exam, nurse exam, hospital management exams, FSSAI exams, or many other exams. So let's start the MCQ session with detailed explanation on immunology. Okay, so the first question is, B cell from EAC rosette has receptor for Fc piece of IgG or has numerous microvilli on surface, or are all of the above, and the right answer about the B cell is option D, that is all are the above. Okay, so EAC rosette indicates the presence of complement receptors. So erythrocyte coated with antibody and complement are incubated with test cell. If the test cell have complement receptor, the EAC will adhere to these cells forming rosette. Okay, so these are all about the B cell. So B cell from EAC rosette has receptor for Fc piece of IgG and has numerous microvilli on surface. So move on to the next question, that is, Hashimoto's thyroiditis is an organ-specific autoimmune disease or a systemic autoimmune disease or a hemocytolytic disease or none of the above, and the right answer about the Hashimoto's thyroiditis is option A. So that is, Hashimoto's thyroiditis is an organ-specific autoimmune disease. So Hashimoto's thyroiditis, also known as chronic lymphocytic thyroiditis, and Hashimoto's disease is an autoimmune disease in which the thyroid gland is gradually destroyed. Early on, symptoms may not be noticed. Over time, the thyroid may enlarge, forming an painless goiter like this. Okay, so move on to the next question, that is, rheumatoid arthritis is an organ-specific autoimmune disease or a systemic autoimmune disease or a hemocytolytic disease or a none of the above, and the right answer about the rheumatoid arthritis is option B, that is it is a systemic autoimmune disease. And this rheumatoid arthritis RA mainly attack the joints, as usually many joints at once. This RA commonly affect joints in the hands, wrist and knees. In a joint with RA, the lining of the joint becomes inflamed, causing damage to joint tissues. Okay. So the next question is RA, that means the rheumatoid arthritis test is a latex agglutination test, tube agglutination test, or reverse passive agglutination test, or co-agglutination test, and the right answer is option A, that is latex agglutination test. So rheumatoid arthritis test is a latex agglutination test. So here the rheumatoid factor is an auto antibody that can help diagnose inflammatory disease. You can have rheumatoid arthritis with normal rheumatoid factor levels, and RF, that means the rheumatoid factor doesn't tend to fluctuate with disease activity. So here in this test, here the IgG coated with latex bind with the patient serum containing rheumatoid factor and agglutination of latex done. So in this way the RA test is performed. Okay, that is the latex agglutination test. This is the latex agglutination test. So the next question is, autoimmune disease occur due to sequestered antigens, neoantigens, altered antigens, or all of the above, and the right answer is option D, that is all of the above. So autoimmune disease occur due to sequestered antigens, neoantigens, altered antigens, all of the above. So what is sequestered antigen? So sequestered antigens are autoantigens that are normally hidden to immune system and therefore unknown. Example, brain, the lens of the eye, or testes. And if they are uncovered by damage exposed to the immune system, are recognized as foreign. One of the theories of autoimmune process. Okay, and these sequestered antigens, some self antigens are sequestered or hidden in specialized tissue. These are not seen by the developing immune system, will not induce self-tolerance. Okay, so here the next one is a healthy immune system defends the body against disease and infection. But if the immune system malfunctions, it mistakenly attacks healthy cells, tissues and organs, called autoimmune disease. These attacks can affect any part of the body, weakening bodily function and even turning life threatening. Okay, and what is the new antigen? So what is the new antigen? So due to the mutation rich nature of cancer cell genomes, cancer can often produce proteins that are incomplete or flawed. These truncated and flawed proteins termed neoantigens. Okay, so understand the sequestered antigens or autoimmune disease and neoantigens. Okay, so move on to the next question, that is, cell-mediated immunity is not manifested in allergy, energy, both of the above or none of the above, and the right answer is option C, that is both of the above. So cell-mediated immunity is not manifested in allergy or energy. So cell-mediated immunity response is the immune response that does not use antibodies if it functions using antigen presenting cells and T cell lymphocyte. And energy means a condition in which the body fails to react to an antigen. Okay, understand? So move on to the next, that is, the earliest immunoglobulin to appear in a disease is IgG, IgM, IgA or IgD, and the right one is option B, that is IgM is the one immunoglobulin or antibody that is the earliest to appear in a disease when first exposed to our body. So here you can see the first antibody appear when we infected with a disease, that is the IgM. Okay, so move on to the next. Humoral immunity is mediated by antibodies, T lymphocyte, macrophages or natural killer cells, and the right one is option A, that is antibodies. So humoral immunity is mediated by antibodies. Next one is cell mediated immunity plays a pivotal role in tuberculosis, leishmaniasis, cryptococcosis or all of the above, and the right one is option D, all of the above. Okay, so the next one is B cell area in lymph node is cortical, follicle, paracortical area or perifollicular region or germinal center, and the right answer is option A, that is cortical follicle. So B cell area in lymph node is cortical follicle. Okay, so here you can see in the picture. So B cell lymphomas here in the cortical follicle. Okay, so move on to the next. The T cell area in lymph node is, so T cell area in lymph node is cortical follicle or paracortical area or perifollicular region or germinal center, and the right answer is option B. So T cell area in lymph node is paracortical area. Okay, so here you can see in the paracortical area the T cells are present, okay, in these blue regions. Okay, so move on to the next question, that is B cell area of spleen is or are perifollicular region or germinal center or marginal zone or all of the above, and the right answer is option D, all of the above. So B cell area of spleen is all of the above, that is perifollicular region, germinal center and marginal zone. So here you can see in the B cell is present all of the above in the spleen. Okay, so move on to the next question, that is T cell area in spleen is perifollicular region, germinal center, marginal zone or lymphatic sheath adjacent to central arteriole, and the right answer is option D, that is T cell area in spleen is lymphatic sheath adjacent to central arteriole. Okay, so next is cell mediated immunity is detected by macrophage inhibition, tuberculin test or both of the above or none of the above, and the right answer is option C, is both of the above. So cell mediated immunity is detected by macrophage inhibition and tuberculin test. Okay, so next question is kinin like activity is present in complement, that is C2B, C3A, C4 or C6 and C7 all are all are complement components. Okay, so the right answer is option A, that is C2B. So kinin like activity is present in complement C2B, and kinin are short lived peptides that cause pain sensation, arterial dilation, increase vascular permeability and cause contractions in smooth muscle. Okay, so here you can see the C2 component are divided or cut into C2A and C2B, and C2B it has a kinin like activity and increased vascular permeability here. Okay, so move on to the next question, that is chemotactic activity is present in complement component, that is C3A, C5A or both of the above and none of the above, and the right answer is option C, both of the above. So chemotactic activity is present in complement component, that is C3A and C5A. Okay, and the main function of the complement in protecting the host from infection or inflammation by recruiting chemotaxis and enhancing phagocytosis by innate immunity, finally leading to lysis of the target cell. So this is the chemotactic activity of complement components. So move on to the next, that is immunoglobulin participating in alternate complement pathway is IgG, IgA or both of the above, none of the above. The right answer is option B, that is IgA. So immunoglobulin or antibody participating in alternate complement pathway is IgA. The alternate pathway is a type of cascade reaction of the complement system and is a component of innate immune system and natural defense against infection, and the alternative pathway is one of the three complement pathway that opsonize and kill the pathogens. The pathway is triggered when the C3b protein directly bind to microbes. Here the alternative pathway, here the pathogens or injured tissue are directly connected with the C3b protein, and then the cascade protein, that is a C3 convertase are activated and C3 protein will be converted to C3A and C3b, and then C3b protein activate the C5 convertase, that is a C5 convertase, and they activate the C5 protein and it divided the C5A and C5A and C5b. So this way in the cascade the complement proteins will be activated and ultimately form a pore, that is a membrane attack complex uh, formed in the cell and cell lysis done in the attached microbe. Okay, so this is the process of alternative complement pathway. So move on to the next question, that is immunoglobulin participating in classical complement pathway is IgG, IgM, both of the above and none of the above, and the right answer is option C, that is both of the above. So immunoglobulin participating in classical complement pathway is IgG and IgM. Okay, so next question is C7 is synthesized in liver, spleen, intestinal epithelium or none of the above, and the right answer is option D, none of the above. So C7 is a complement protein. Okay, so next is cytolytic reaction is an example of hypersensitivity of type 1, type 2, type 3 or type 4, and the right answer is option B, that is type 2. So cytolytic reaction is an example of hypersensitivity of type 2. So type 2 hypersensitivity of allergic reactions is an antibody mediated process in which IgG and IgM antibodies are directed against antigens on cells such as circulating red blood cells or extracellular material such as basement membrane, and this subsequently leads to cell lysis or tissue damage. Okay, so next question is immune complex disease is an example of hypersensitivity type 1, type 2, type 3 or type 4, and the right answer is option C, that is type 3. So immune complex disease is an example of hypersensitivity of type 3. So what is type 3 hypersensitivity reaction? So in this type 3 hypersensitivity reaction, an abnormal immune response is mediated by the formation of antigen antibody aggregates called immune complex. They can precipitate in various tissues such as skin, joints, vessels or glomeruli and trigger the classical complement pathway. Okay, So move on to the next question, that is Oakley Fultrop procedure is single diffusion in one dimension, double diffusion in one dimension, single diffusion in two dimension, or double diffusion in two dimension. And the right answer about the Oakley Fultrop procedure is option B, that is double diffusion in one dimension. So double diffusion in one dimension Oakley-Fultrop test is a procedure is antibody, that is antiserum, is incorporated in agar, poured into a tube and allowed to harden. And in next, a second layer of agar without antibody is placed over and allowed to solidify. Okay, and then antigen solution is placed over the agar. So the precipitin band appear in the plain agar column. Okay, so this is the picture. Here you can see. So here first the agar is present, then the soluble antibody is there, and antibody will go diffuse this way upside, and then the soluble antigen is added. So precipitation occur in this region. Okay, so move on to the next question, that is primary mediators of anaphylaxis is or are histamine, serotonin, ECFA, or all of the above. And the right answer is option D, all of the above are primary mediators of anaphylaxis. Okay, so the next is secondary mediators of anaphylaxis is or are SRSA or leukotrienes or prostaglandins, or all of the above. And the right answer is option D, that is all of the above. So secondary mediators of anaphylaxis is all of the above. So anaphylaxis is a severe, potentially life-threatening allergic reaction. It can occur within seconds or minutes of exposure to something you are allergic to, such as peanuts or bee stings. Okay, and anaphylaxis causes the immune system to release a flood of chemicals that can cause you to go into shock, like blood pressure drops suddenly and the airways narrow, blocking breathing. Okay, so this is the anaphylaxis. So anaphylaxis is a serious allergic reaction and should be treated as a medical emergency. It can occur within minutes of exposure or take several hours. So sign of the anaphylaxis, here you can see central nervous system. It can attack the central nervous system, like anxiety or light headache, headachenes or loss of consciousness, confusion, headache, heart and vascular, low blood pressure, fast or slow heart rate, skin like it can affect also skin, the flushing or hives or itching. So this kind of signs of anaphylaxis you can see. Okay, so this is the main thing. And in next, that is the last question, that is the following is a primary mediator of anaphylaxis. So SRSA, serotonin, leukotrienes, or prostaglandins. The right answer is option B, serotonin is the primary mediator of anaphylaxis. Okay, so thank you for watching this video, and we will see you on our next video, that is the part 12 of immunology MCQs. Okay, thank you for watching this video.